This presentation considers the power of education used as a change agent in developing countries. In particular, I aim to consider what progress has been made through the use of community education programs in reducing maternal mortality in India. Over time, the Millennium Development Goals became heavily influenced by target setting. This meant that real impact and change was lost in order to meet those goals which were set from the top down. This also meant in some cases that suitability may have been lost. In light of this, the development of the Sustainable Development Goals applies bottom-up knowledge to increase their relevance and applicability. By taking this approach to engage with communities and by recognizing regional and national policies, suitable goals could be produced in order to address global imperatives, and that would be much more efficient to achieve and maintain. Sustainable Development Goal 3 is to ensure healthy lives and promote well-being for all at all ages. As well as covering other health-related issues, Sustainable Development Goal 3 addresses the suffering and health issues related to reproductive, maternal, newborn and child health. On a global scale, as of 2018, the maternal mortality ratio had declined by 37% since 2000. Nevertheless, in 2015 alone, 303,000 women around the world died due to complications during pregnancy or childbirth. The UN has set targets to, by 2030, reduce global maternal mortality ratio to less than 70% per 100,000 live births. They also aim by 2030 to ensure universal access to sexual and reproductive healthcare services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. In a study of global health in 2012, Kapas, Grabe and Keller found that in all developing countries, infant as well as maternal mortality was high, and their determinants were also the same. Decreasing the level of risk factors can control both maternal and infant mortality. They also note that when considering the available data and organising how to go about tackling this issue, that education of women is for awareness, perception and modernity, whereas caste variable gives an idea about the accessibility and the vulnerability. The international dimension of education is not limited to schooling. It also includes the development of education programs for communities as a whole. In their 2006 India case study, Cho and Chen concluded the following determinants of maternal mortality: knowledge of reproductive health, access to and utilisation of reproductive as well as medical health care, and finally socio-economic and cultural factors associated with the knowledge and use of services. As noted, improving knowledge and educating communities about the above issues can be just as much as a powerful change agent as the physical aspect of transport services and personnel availability. Providing communities with the knowledge on how to use the services which are provided by charities is a powerful change agent and a powerful tool of education. When introducing the Sustainable Development Goals, the UN stated that implementation success will rely on countries' own sustainable development policies, plans and programs, and will be led by countries. The Sustainable Development Goals will be a compass for aligning countries' plans with their global commitments. They provide the information and support to allow governments to implement action. Also, charities such as Save the Children and Mary Stopes are valuable education providers. Both of these charities work with communities directly supporting those in need and working to develop systems already in place. Save the Children work locally with partners, health workers and communities to mobilise resources. Their focus in particular is to help leverage existing structures, strengthening facilities and ensuring availability. They try to ensure at least the basic emergency services are readily and widely available. Their main maternal and reproductive health goals are to create a supportive environment for the use of modern contraception for all girls and women who need them, to increase access to, improve the quality of and generate demand for family planning services, particularly among hardest to reach communities including the urban poor, youth, postpartum women and populations in emergency settings and those in transition. strengthen local delivery of family planning education and services, especially to adolescents, training community health workers to provide a wide range of methods including injectable contraception, improving policies, enhance systems and services, build local capacity for healthcare providers to provide respectful maternity care to all girls and women, increase access to and improve the quality of antenatal and postnatal care services and skilled attendance at birth, and to understand and overcome practical and cultural barriers to better reproductive health, breastfeeding, and care practices by communities and healthcare providers. Mary Stopes International are a charity dedicated to maternal health. They recognise that many deaths could be preventable if women are provided with the right support and knowledge. They also deeply consider the targets set by Sustainable Development Goal 3 and work closely with governments and other organisations to help them achieve. Their work includes educating women about safe motherhood, providing parental and obstetric care, training skilled birth attendants, managing complications and emergencies, and caring for mothers after birth. The Foundation for Reproductive Health Services in India are a non-governmental programme working in affiliation with Mary Stopes. In 2015, they emerged as India's #1 provider of clinical family planning services in the NGO and private sector. They work in partnerships again, maintaining knowledge and sharing support from the bottom up, strengthening and sustaining available networks. These are the stages of support they provide. The wide range supports both practical implications, such as facilities, transport, medical, and the psychological or cultural, providing counselling, reproductive education, and family planning services. Working to change cultural behaviours can be a barrier. Save the Children, Mary Stopes, and FHRS recognise this and use their knowledge to overcome difficulties linked to cultural behaviours. For example, educating through family planning to women and couples to space out pregnancies, as culturally, rural families tend to have many children to work, but this can have fatal effects to both the mother and the child. Globally, as mentioned previously, the maternal mortality ratio has declined, and thanks to training provided by such charities, over the period 2012 to 2017, almost 80% of live births worldwide occurred with the assistance of skilled health personnel, up from 62% in 2000 to 2005. As for Indian progress, FRHS India measure their impact by considering the number of clients they have served, number of couple of years of protection generated, number of unintended pregnancies averted, and the number of unsafe abortions averted, and then they consider the overall number of maternal deaths averted. These statistics show the progress made by FRHS India. Education programs rely on the continued support of local and national policy. Equally, it is important for them to make change that is sustainable and that they are constantly developing facilities so that they are able to stand alone. This is why education of the community as a whole at different levels in respect of different ages and responsibilities is important for sustainability. For example, teaching adolescents and giving them the education about contraception that's provided can prevent unwanted pregnancies and fatal abortions. Teaching couples to space out families and training skilled personnel. Continued research should be conducted to further understand the social and cultural views relating to women and motherhood, and the effect that these can also have on the rate of maternal mortality, and how these issues can be approached.